This is the Advanced Medical Unit at St. Peter's Health in Helena, and in recent days, these 6 beds have almost always been full with COVID patients. From 7 p.m. to 7 a.m. every day, it's the nurses on the night staff who are responsible for taking care of these patients.
We're here all night. There's always somebody here waking you up, taking your vitals.
Kaylee Nelson and Victoria Fowler are both travel nurses brought in from other hospitals to help cover staffing needs at St. Peter's.
If I can, go to different places and help other people through the things that our floor was having problems with, then it feels like I'm making more of a difference.
COVID patients are currently housed in units throughout the hospital. For more serious cases, nurses are constantly monitoring patients, especially their oxygen levels.
There are some people that they take their mask off or their nasal cannula off and they drop immediately. And then when that happens, they can go into funky heart rhythms, and sometimes it takes them a long time to recover.
Nelson and Fowler say they've seen distinct differences based on whether patients have been vaccinated. Those without the vaccine have been more likely to stay longer and need more extensive care.
It's not a quick process getting out of the hospital when you have COVID.
Burnout has been a very real issue for nurses over the last 18 months.
It gets exhausting seeing people who are in their 30s or 40s with 1- and 2-year-old kids at home that end up being hospitalized.
A lot of nurses, I think, are leaving the bedside position or retiring. I think it's been a big transition trying to fill those holes.
Nelson and Fowler report the latest spike in COVID patients really began about a month ago.
At one point when I was here, there were no COVID patients at all. No isolation carts, no gowning up, no. We didn't even have to worry about it.
Now, those patients are again taking up a significant portion of St. Peter's available beds, and nurses say some are coming in from elsewhere in Montana or neighboring states because closer hospitals don't have room.
I just think that there's a lot of disconnect. When you're not seeing it every day that you work, it kind of goes to the back burner until you get COVID.
I think it's important that people don't forget that we're still in COVID times.
St. Peter's Health says they currently have multiple nursing positions open in every unit in the hospital, and it remains a challenge to find people to fill them. In Helena, Jonathan Amberian, MTN News.